Hello friends, if you are suffering from nerve compression in spine, let's today understand the causes, symptoms and treatment. First of all, if somebody in your family or you yourself are suffering from nerve compression in the spine, symptoms would vary from numbness, tingling in the arm to weakness in the arm or severe pain traveling down your arm till your fingers, or it could be in the form of sciatica. So normally, let's first understand the reason behind nerve compression. A lot of us are suffering from poor posture related problems. When we are not sitting well or sleeping well, we are not maintaining our posture well. In that case, the first and the foremost reason that can happen is disc herniation, which is also known as slip disc. So when the disc that acts as a cushion between the bones, it gets dislodged from its natural position and starts pressing the nerve, it is known as slip disc, and it can cause symptoms of sciatica or severe radicular pain. Second is age-related degeneration, which is known as spinal canal stenosis. Third is if the joints of the spine they become age-related arthritic, which is also known as facet joint arthritis, then also nerve compression can happen. Sometimes nerve compression can happen because of slipping of the bone, which is known as spondylolisthesis. Or it can also happen because of any fracture or trauma like in accident, which is very common these days. In those situations also the nerves may get pressed. And also some rare conditions like tumors are also there, which can happen in the spine and can cause nerve compression. So whenever somebody is suffering from nerve compression, treatment depends on which part of the neck is involved. Like in the neck, which is known as cervical spine, it can cause neck pain or pain radiating down the shoulder, arm, or even up to the fingers. It can cause numbness and tingling in the hand, weakening of the grip. Objects may fall again and again when the person is actually suffering from weakness of the hand grip. In the lower spine also, the symptoms can vary. Sometimes it could be back pain, sometimes it could be pain in the buttock, thigh or leg region, which is known as sciatica. It can cause numbness in the foot, difficulty in standing or walking, cramps in the leg. So such symptoms, they point out towards nerve-related pathology. For diagnosis of such conditions, MRI scan is the best thing. Non-surgical treatment is the first and the foremost and is helpful in almost 97% of the patients. With rest, activity modification, proper sitting posture, and medicines, we are able to take care of this. Medicines primarily involve pain and inflammation reducing medicines. Sometimes we also add nerve medicines. Also, sometimes physiotherapy is helpful in the form of TENS or ultrasonic modality. When things are not getting controlled by conservative treatment, then only we think of surgery. Surgery is normally required in cases of persistent pain, or if there is nerve damage in the form of numbness, tingling, or weakness, or paralysis, or involvement of tracts or nerves controlling motion and urine. These days, the surgery has also advanced a lot. Like if we have a patient suffering from lumbar disc herniation, we prefer to go for endoscopic spine surgery because it is a minimally invasive procedure with less than 1 centimeter of skin cut, with minimal of muscle damage, minimal blood loss, and very good result. Similarly, if the problem is in the cervical spine, then also we prefer to go for modern technology and modalities like cervical disc replacement surgery so that the patient may have a normal life after surgery. In cervical disc replacement surgery, we remove the disc that is damaged and we replace it with an artificial disc. In situations where there is tumor in the spine, we have very good techniques and latest technical advancements where we can remove the tumor and get the patient back to normal life. Similarly, if the nerve compression is because of some fracture, then we have modern technologies like minimally invasive fracture fixation surgeries, which can give very good result. So if you are suffering from nerve compression in the spine, don't worry, visit your spine specialist and he will guide you so that you can get back to your normal life. All the best.